Welcome back to your healing journey for cancer remission. I am Dr. Carolle Jean-Murat. If you're new, please begin with the Start Here audio. For those continuing the journey, today in episode 2, Understanding DCIAM, I will explain the science behind the Dr. Carolle instant anti-distress method and share how I discovered this powerful technique. Before we dive into today's session, let's go through the Dr. Carolle Instant Anti-Distress Method, DCIAM, so you can quiet your mind, calm your nervous system, and prepare your whole being to absorb what you are about to learn. Please close your eyes and focus on your eyelids. Relax your jaw. Let your tongue rest comfortably. Keep breathing naturally, inhaling slowly and deeply to your nose. Hold it as long as you can, and then let it out slowly through your nose. Use the pads of your index and middle fingers of your dominant hand to tap on your temple gently while saying silently or aloud, "All is well, all is well, all is well." Let's take 3 deep breaths together. Ready? First breath. Inhale slowly to your nose. Tap gently. Say, "All is well, all is well, all is well." Exhale slowly through your nose. Second breath. Inhale slowly to your nose. Tap gently. Say, "All is well, all is well, all is well." Exhale slowly through your nose. Third breath. Inhale slowly to your nose. Tap gently. Say, "All is well, all is well, all is well." Exhale slowly to your nose and continue to breathe slowly. Cancer is not just a physical journey. It is an emotional, mental, and spiritual initiation. From the moment of diagnosis, you're thrust into a world of decisions, fears, appointments, and uncertainty. Anxiety and worry multiply about survival, treatment, finances, family, and the future. Today, I will share with you a simple method that I've used worldwide after tragedies and natural disasters to bring instant relief. This method has been implemented in schools, hospitals, in community gathering across Haiti, Mexico, and the United States. I use it personally when I feel overwhelmed, before and after consultation, or when I do an exclusive retreat, before I do an Instagram live, when I speak at a conference, at my monthly stress relief sessions, and when I am with traumatized individuals, and anywhere I teach, with excellent results. For individuals with cancer like you, it should be an integral part of your daily routine. It is especially helpful when feeling overwhelmed, hopeless, and out of control. It will help you prepare the mind and body for surgery, chemotherapy, radiation, and the many tests you will face. The stress response versus the relaxation response. Let me explain why this is so crucial for anyone dealing with cancer or chronic illness. We have two complementary nervous systems, the sympathetic and the parasympathetic. Whenever we are in a stressful situation or are overwhelmed by fear, anxiety, and worry, the sympathetic nervous system triggers an acute stress response that prepares the body to fight or flee. The relaxation response is a natural method of engaging the parasympathetic nervous system to reverse the effects of the stress response. When you are in stress response, which most people with illness are constantly in, your body produces stress hormones like adrenaline and cortisol. Your immune system slows down because your body thinks you are in an immediate danger. Your digestion stops working correctly. Your cellular repair mechanisms are disabled. Blood flow is redirected away from healing and toward survival. But when you activate the relaxation response, which is what we do with the DCIAM method, everything changes. Stress hormones decrease. Your immune system comes back online. Your digestion improves. Blood flow returns to healing processes. Your body can finally do what it was designed to do, heal itself. The problem is, most people have been in stress mode for so long, they've forgotten how to access the relaxation response. That's where my techniques like the DCIAM become essential. They give you instant access to the healing state your body requires for healing. This is why every audio I create includes this nervous system reset. Your body cannot heal in stress mode, but it can perform miracles in relaxation mode. Stress versus distress. There is a difference between everyday stress and true distress. Everyday stress can be caused by traffic or a busy schedule. Distress is when your body feels threatened, a shocking diagnosis, a traumatic loss, witnessing tragedy, procedure they fear, or a wave of panic that feels like the room is closing in. In distress, the amygdala, the brain's alarm system, locks the body into fight or flight. Counting, remembering sequences, or just relaxing often isn't possible. I know this because years ago, on a book tour, I experienced a severe panic attack myself. My logical mind disappeared. I could not think straight, which made the panic even more severe. Chronic stress and distress lead to over 80% of abnormal lab results and chronic diseases, including cancer. My journey to discovering the DCIAM. When I had my panic attack, I was plagued with anxiety, fear, worry. I couldn't sleep during a very stressful time in my medical career. I discovered many non-traditional techniques that helped me deal with my stressors while finding and dealing with the root cause. Unresolved issues from childhood, emotional, physical, and sexual trauma that needed to be addressed. Prior to having full-blown panic attacks, I was told that I had PMS, premenstrual syndrome, that I was in perimenopause, or it was menopause. But working with a therapist, I discovered the truth. I now had a new way to help my patients. While dealing with my panic attacks, I learned many tapping modalities. They included using the pads of the index and middle finger to tap specific areas of my face and upper body, using a predetermined sequence. I also had to define beforehand what I felt and rate how intense these feelings were. When I finished tapping, I had to rate these feelings, and if they were still high, decide if I needed to tap again. I realized years later that during an acute stress response, being in distress or having a panic attack, it is difficult to remember sequences or where in the body to tap or to count. The Haiti earthquake and the birth of the DCIAM. For years, I had been making frequent trips to my beloved Haiti, offering medical care as well as many public health programs. In 2010, a devastating earthquake took over 300,000 lives in Haiti. Over half of what I have been doing had disappeared over half of what I have been building over the years for my people disappeared in a 5-minute shake. The survivors came to our clinics in droves. I had to devise a way to take them through a speedy process of stress and anxiety relief. It was not easy at first. I was not a trained psychologist or someone who deals with acute emotional trauma, but I had no choice. It was me helping them or nothing else. Wanting to help as many people as possible, whether then after a shooting, a suicide, or a natural disaster, I refined these techniques into the Dr. Carolle Instant Anti-Distress Method, which is easy to learn. The DCIAM consists of 4 simple steps. Step 1, control breathing, no counting breaths, just slow, deep breathing through your nose. Step 2, mind centering, present moment orientation by focusing on your eyelids and relaxing your tongue. Step 3, affirmations, short, targeted phrases like all is well. Step 4, precision tapping, 1 point only, your temple, using the pads or your index and middle finger of your dominant hand. That's it. 4 simple steps that anyone can remember, even in the midst of overwhelming distress. After years of practice, I am totally relaxed after taking 1 deep breath and tapping once or twice on my right temple. I am right-handed. Over time, 1 deep breath and a simple tap may be all you need. A word about root causes. Being able to quickly stop the stress response and activate the relaxation response is one of the best gifts you can give yourself. But remember that symptoms are the tip of the iceberg. True healing demands finding the root cause of your stress fear, anxiety, and worry and dealing with them. When I experienced panic attacks, I learned that it was the accumulation of adverse childhood experiences I suffered, including emotional, physical, verbal, and sexual trauma. During that stressful time in my career, I dealt with many personal and professional issues, and I felt just like that little girl who had no way out. These life events caused unresolved issues to surface. Realizing what was going on and wanting to stop the panic attacks allowed me to forgive the abusers, understand myself, and better help my patients. So take a life inventory to find the root cause of your symptoms and learn how to deal with them. Sometimes, as I did for a while, you may need psychotherapy and even medication. The DCIAM gives you instant relief. But for lasting healing, we must go deeper, which is exactly what we will explore in the episodes ahead. Please note, the DCIAM supports but does not replace medical or mental health care. If you're in danger or experiencing a medical or psychiatric emergency, please seek immediate professional help or call local emergency services. I am grateful you joined me for this healing session. As we close, let's return to the calming practice of Dr. Carolle Instant Anti-Distress Method, DCIAM. It is my hope that this practice brings you the peace your body needs to heal. Please close your eyes and focus on your eyelids. Relax your jaw. Let your tongue rest comfortably. Keep breathing naturally, inhaling slowly and deeply through your nose. Hold it as long as you can, and then let it out slowly through your nose. Use the pads of your index and middle fingers of your dominant hand to tap on your temple gently while saying silently or loud, "All is well, all is well, all is well." Let's take 3 deep breaths together. Ready? First breath. Inhale slowly to your nose. Tap gently. Say, "All is well, all is well, all is well." Exhale slowly through your nose. Second breath. Inhale slowly to your nose. Tap gently. Say, "All is well, all is well, all is well." Exhale slowly through your nose. Third breath. Inhale slowly to your nose. Tap gently. Say, "All is well, all is well, all is well." Exhale slowly to your nose and continue to breathe slowly. Please use this method anytime you feel overwhelmed. The goal is to achieve calm and inner peace by the third breath. Thank you for listening today. My next audio, episode 3, DCIAM practice session, is a complete guided practice where I'll walk you through each step in detail. You can return to episode 3 anytime you need calming relief. Subscribe and turn on notifications so you don't miss it. If you're ready to go deeper to release trauma, restore peace, and open the door to cancer remission, I invite you to visit my website, www.drcarolle.com, and explore my services, which include telephone consultations, exclusive retreats, books, audio series, and the opportunity to join me during my live internet sessions and healing concerts. You'll find links in the description below and in the top comment. If this video inspired you, please like, subscribe, comment, share it with someone who might benefit. And remember, healing is possible. Together, let's open the door to cancer remission. Click and keep moving forward because your journey continues there.